Hi everybody, my name is Anish and I'm one of the teachers at Dr. Hazan's Academy for Scribes. And today I'm going to talk to you about knee osteoarthritis, which you've probably heard of as just arthritis. And it's so common, it affects over 20 million US adults, so you probably know someone with it. And so really quickly, just an outline of what we're going to cover. We're going to talk about the anatomy and the pathophysiology. We're going to talk about what you should be looking for in your history and physical exam. And then we're going to be talking about what your treatment options are. So let's go ahead and get started. So here you'll see two pictures of the knee. On the left side, you'll see the healthy knee on both of these images, and on the right side, you'll see the damaged knee. So let me orient you really quick. This right here is the thigh bone, or the femur, and this right here is a leg bone, the tibia. And in between these two bones, there's this shiny cartilage, which provides a cushion, and this little area over here, these discs called meniscus. Now, what happens over time is as a person ages and there's overuse of the joints, you start getting destruction of this cartilage. And so it starts looking like this. And then this meniscus also starts eroding as well. And so what you'll see is these bones that used to have a cushion, as you can see in this picture, the bones in the cushion, no longer have that cushion. And now the bones are pressing on each other. And then once they start pressing on each other, you start getting these little spurs, these bony spurs, and that only causes more irritation. So these are the three characteristic features of osteoarthritis: the destruction of the cartilage, the erosions of the meniscus, and the bony spurs. So now that you have a background of what goes on, let's quickly talk about what you would look for in the history and the physical exam. So once again, I'd like to use the mnemonic old cards to remind myself what I should be asking for. O is for onset, so how long have they had this pain? L is for location, so where is the pain? Usually should be right over the knee joint. D is duration, how long do they get this pain when they do get it? And then I want you to pay particularly focus on CARTS. CARTS, C is for characterization. And this is, how would you describe the pain? And most people with osteoarthritis describe the pain as achy, so that's a key feature. The next thing I want you to focus on is aggravation, the A, and alleviation. So what makes it better, what makes it worse? And this is extremely key because in osteoarthritis, what happens is over the day's time, the pain gets worse. So worse in the PM is a common feature. And then for alleviation, it usually gets better with rest, which is what makes sense. So those are three key features: achy, worse in the afternoon, and better with rest. Radiation, usually the pain usually just stays right over the joint. T is for temporal, and this is another important one because usually people with osteoarthritis complain of morning stiffness. Remember that. Temporal is time. So in the morning time, AM, they get morning stiffness. And then S is severity. You want to know how bad it's impacting their life and how bad the pain is on a scale of 1 to 10. So now that we understand quickly what to look for in the history, on physical exam, I want you to pay attention to a couple things. One is range of motion. They shouldn't be able to move their knee like they used to. Usually it results in limited range of motion. And then the other thing is you might even notice some cracking, some crepitus is what we call that, as they're moving their knee. Finally, you might even notice some swelling, some effusion over the knee. It won't be red, but you might see some swelling. So now that you know what to look for in history and physical exam and you've identified the disease, how should we treat it? So look at this as steps. So this is the first step, this is the second step, and so forth. So in the first step, the patient is just coming in. And what would we recommend? Well, we would recommend that they probably just go with over-the-counter meds, some ice, some rest. But there's two key things I want you to pay attention to. An exercise bike is extremely helpful because it helps smoothen out their cartilage. So that's another recommendation we would do. The other thing we would do is help them try to lose weight because that puts less pressure on their joints. So you want to encourage that throughout. If that doesn't work, then you can consider pain cream or oral medications, maybe even cortisone injections. But let's say all of that stuff doesn't work. Then you might need to consider more surgical intervention, and usually that begins with an MRI. And the MRI might show a tear, or maybe it may show some more irritation. And so then you would consider two kinds of surgeries. You might consider a meniscular transplant. You might consider